Welcome back. Thom Hartmann here with you. I'm live from Portland. In our D.C. studio is Charles Sauer, libertarian economist and president of the Market Institute, marketinstitute.org. And you can tweet him at Charles Sauer. It's S-A-U-E-R is how he spells his last name. Charles, welcome back.
Thanks for having me.
Charles?
Thanks for having me.
Great to have you with us. So you're welcome. So the Republicans are all kind of twisted up in knots right now, trying to figure out what they're actually up to with regard to how to repeal Obamacare, et cetera. And it seems to me like this is the absolute biggest hole in the whole libertarian philosophy. Is the essence of it being essentially I got mine, screw you, and there's how and I know we've talked about this before, but I don't think I've ever achieved any clarity at all in terms of understanding your worldview in how in a country as diverse as the United States, where you've got people from dirt poor, you've got people who are not capable of taking care of themselves, whether they're handicapped or mentally handicapped, young children. You've got older, elderly people. I mean, we've got this huge spectrum of people. We've got, cities, rural, rich, poor, all this kind of stuff. And yet, as a matter of national security, if we don't have a national healthcare system, we are vulnerable to a bioweapon. As a matter of national productivity, if people don't have access to healthcare and they still have to work and they're sick and they're sneezing all over your salad, we're losing, and we do every year, lose literally billions of dollars of productivity to people, being unnecessarily sick because they were sickened by workers around them who couldn't afford to take a day off or whatever. Which I guess is kind of wandering into a slightly different topic, but how, and I realize, given the caveat, there's never been a successful libertarian country or state or even city anywhere, so we don't have an example for this. But how, in your Ayn Rand mind there, Charles, how would you provide health insurance or health care? Forget about insurance. How would you provide health care to every American?
Well, fortunately, what I'm looking for is affordable, equitable health care, something, a way to increase the quality, access, and lower the price to health care. And this is something where I actually find it usually appalling where the left is on healthcare, and that's this top-down fascist approach where they believe that the bureaucrat on top knows how everybody needs healthcare, where they're going to do it, and that's the way to give healthcare to the healthy and not actually address the needs of the sick. So what I'm for is providing care to the sick. So where we actually have functioning markets in the U.S. We have a surgery center in Oklahoma. They list prices that is a cash price. Their cash price is about 20% of what it costs at the nonprofit hospital down the street. And that's what people are actually paying to the hospital and what they're actually paying to the surgery center in Oklahoma. But it's not just the prices there, because we can actually see competition working in this market, because we also have surgery centers in Florida, in Virginia, in California, and moving also into Colorado and a few other states. And the difference in the prices in these cash places are within an airplane ticket of each other. And that's because there actually is competition in healthcare. And this is the libertarian approach, is to free it up. We have a family doctor in Texas who charges cash prices. She gives discounts to patients that wear in spurs. And you can't do that if you're working on a government for a government program like Medicare or Medicaid. But she treats day laborers and billionaires. She's amazing. Juliet Madrigal-Dersch down in outside of Austin, Texas. But the libertarian approach is to let the free market work, to give people money or let them keep their own money and shop for healthcare. And that's why the Graham Cassidy bill is great, because it takes the money outside of D.C. It stops this federal bureaucrat and it gives it back to the states. It's not the perfect libertarian approach, but it starts increasing the ability for people to have choices by at least starting by letting the states have choices on how to provide health care.
Okay, I'm not going to get all reactive about your calling single-payer fascistic when the definition of fascism is the merger is basically the acquisition of government power by corporations. So it's the opposite of that. But in any case, you never answered my question, Charles. How are you going to provide health care to a homeless person on the street in San Antonio? How are you going to provide health care to a mother of two in Akron, Ohio, who's working a minimum wage job and literally has to maybe one day a week only eat half the food that she would normally eat because she can't afford it? How are you going to do that? I mean, you're not going to do that by saying, hey, you can shop prices at surgery centers. This answer by anecdote is nonsense. Let's talk systemically. How do you provide health care to every American?
I have the actual non-anecdotal story. You made up a story about a homeless person on the street. The fact is I gave you a real price. The Oklahoma Surgery Center of Oklahoma charges 20% of what the nonprofit hospital charges. I don't use the anecdotes here. I have real numbers, and so that's the deal. All we have on your side are the anecdotes.
Charles, there are homeless people all over the United States. So you're saying that the homeless person needs to go to that surgery center and should be delighted that the surgery to cut away the MRSA on their leg or whatever is only going to cost them $22,000 instead of $29,000. Is that what you're saying?
Actually, what I'm saying is that the government programs that you're advocating for have already proven to fail. And while those government programs are proving themselves to fail, what is coming up and propping up and helping those homeless people that you're talking about are free markets and charities. That is what is helping those people. But the government programs, look, we have, again, non-anecdotal. We have research that came out of the only randomized study in Medicaid that showed that it didn't increase or improve the health of the people that got it. That is non-anecdotal. Coming up with stories and trying to bring a figure into this that is going to imply sympathy, that's anecdotal.
So setting aside all the words here, what I heard you say is that the way that you're going to provide health care to people in the United States who right now can't afford to buy health insurance, from homeless people to low-income people, is that they should depend on charity.
I'm saying that the government programs that are on top are already making it unaffordable. The only way to make it unaffordable are to use like a concierge medicine.
I'm not asking you for a critique. I'm asking you for a solution.
Yeah, the solution is happening in the U.S. as we speak because the government programs have created this problem. We have Atlas MD in Kansas. They're charging $50 a month for unlimited visits to your doctor. We have different versions of that in Florida where you have unlimited access to your doctors for something that's a reasonable price. What happens when your doctor finds a lump? What happens when your doctor says, hey, look at this, we got a stage 1 cancer here. It's only going to cost you $70,000 to have the surgery and the radiation. Well, the $70,000 is what it costs when you have Medicare not paying doctors, when you have hospitals that are not treating the patient as it's only going to cost you $40,000 because we're super competitive. Again, where I started with was 20%, all right? So if you work back from your 70,000, what are we talking about? 15,000? If you find a lump, it should be worth 15,000, and there's charities for the people that can't afford that 15,000. But what is bankrupting the system is the fact that right now hospitals are charging 70,000. Charities in the United States last year provided about $5 billion worth of all types of services. That's how much we spent on healthcare in the United States in 3 days. I mean, well, anyway, Charles Sauer, marketinstitute.org is the website. You can tweet him at Charles Sauer, S-A-U-E-R. Charles, thanks. Great talking with you. Thank you.